digital health and innovative medical devices in healthcare. I request Dr. P.N. Singh, clinic in charge and senior consultant, Holy Family Hospital, on the DeAsh, please. Mr. Arun Agrawal, founder, Janitri. Janitri, Dr. Ranjit, can we get Janitri speaker? Ms. Neha Rastogi, founder and CEO, Agatsa. Mr. Ashwin Amrapur, founder and CEO, Aikenist Technologies. Ms. Naiman Bindra, lead North Operations, Salicit Technologies. Dr. Seema Singh, founder, Unconsult. May I request all of you to be on the stage, please. Thank you so much. So this is all device and technologies which will help you to make it real digital, digital healthcare. So over to Dr. Saab, over to you. Here, Dr. Saab.
Good evening, everyone. It won't be wrong if I say that we are living in digital era. Digital technology is influencing our everyday life, all aspects of life, and in that matter, healthcare is no exception. Healthcare also is progressively being digitalized to improve its efficiency and care. There are endless examples how digital technology is influencing the healthcare. To name a few, e-medicine, e-pharmacy, robotics, artificial intelligence, and various wearable devices. Our next session is on digital health and innovative medical devices in healthcare system. So I would like to request the speaker, Mr. Arun Agarwal, to come and deliver a talk on it.
Thank you, everyone. Hi. Good evening. This is Arun, founder of Janitri Innovation. We are a Bangalore-based company focusing on wearable plus software plus AI/ML-based solution for pregnancy, labor, and newborn. So how Janitri journey started? So before I started Janitri, myself spent time in 100+ hospitals across the country just to understand problems in mother and child healthcare, and just to understand why mothers and babies are still dying while giving birth. Even we are in 21st century, but why that number is still high. And it's just not the situation in India, but even the developing world. And that spent of time of 100+ hospitals across the country. I have seen live birth, seen C-section, spent time with gynecologist, pediatrician, neonatologist, pregnant women, their family. And that gave me a good amount of idea like what exactly is missing. And that journey of spending time starting from a community level, PHC, CHC, district hospital, medical college, to a private hospital, to a very premium hospitals, and saw the difference. So what we figured out, 80% of these mortality and morbidities can be prevented if a right monitoring can be done at the right time and if right decision can be taken. And that is something which was missing. And we started our journey in 2016, considering that we should be able to provide a wearable plus software-based technology to monitor some couple of critical vitals during pregnancy, labor, and newborn. So yeah, I talked about this challenge, like it's a lack of monitoring and early decision making. That's a broader challenge. And that is what Janitri is looking to solve for the 1,000 days journey. And I'll talk about this 1,000 day journey clinically. So the whole 9 months of pregnancy, then labor, and after the delivery until the newborn becomes 2-year-old. So this 1,000 days journey clinically, it is very, very important from the prospect. It's very sensitive, very critical. And that is the product what we are building for 1,000 days journey. starting from as soon as she conceive and the whole 9 months, then further labor and after delivery for both mother and baby until the next 2 years. We want to make sure that at each and every phase of this 1,000-day journey, each and every parameter should get monitored at the hospital setting or at home setting, and early decision can be taken if there is something wrong. So we started with labor monitoring devices. Now we have a couple of SKUs which we have introduced in the market. So this is a portable Doppler and Toco based and mobile application based device which can monitor the fetal heart rate, which can monitor the contraction. A gynecologist or an obstetrician can see the data remotely on their phone, and it comes with the automated interpretation. We found that, in the district hospital kind of a setup or in the busy labor ward, there are 10 deliveries or 10 patients simultaneously in the labor phase, and nurses are going to each and every bed and looking at the fetal heart rate and contraction graph. So through this, we have also solved that problem by putting the centralized monitor on the nursing station. So it's happening at the ICU since long, but it never happened in the labor ward. And that is something what we are bringing. So ultimately, we have this setup. You can also check this setup on the back side. So this is a setup which goes in the bedside in the labor setting with couple of sensors which can give you the fetal heart rate, contraction, maternal heart rate, the baby kick, and it's all Bluetooth wireless probes. Talk to the mobile application, so it has interfaces like nurse interface, doctor interface, and administration interface. Ultimately, if you see this particular product, when I showed you, this comes with the Doppler and Toco, and it has to be placed on the abdomen with the belt, which is that's little bit of uncomfortable for the pregnant woman. And to bring that comfort level, we have also brought this technology, which is a patch-based technology to monitor fetal heart rate, contraction, and maternal heart rate. This do not need any belt to place it. You do not need to relocate the sensor until she deliver. As soon as she get admitted in the hospital setup after the labor pain, you just place this patch until she deliver, and it will keep giving you the 3 parameters simultaneously. So that is another technology what Janitri have developed, and it comes with the in the form of DeoMax, which comes with both the sensor. So when we have started deploying these products in the maternity hospital, both in public and private setup, and when we started talking with a lot of obstetrician nurses and all, we figured out that after the delivery, there are a couple of another maternal parameters which gynecologist needs to monitor, like BP, pulse, and SpO2. And further, they are calculating the shock index value of the mother, which is linked to postpartum hemorrhage. And they started asking, why can't you also give that us in the same product, which can also give us the shock index value. So we have introduced this another product which can monitor those vitals and can give the shock index value and the graph to the nurses and gynecologists, so they can further take decision to prevent the postpartum hemorrhage risk. So these are the direct impact products which we have ranged as a part of our 1,000-day journey. So yeah, this is something which Max Plus, which comes with both. So this is a first product which has both the features simultaneously in the world. It's a smart fetal maternal plus shock index monitoring device. Nobody gives that. Now let's come to the software part and how we have also evolved our software journey for this 1,000 days product. So ultimately, if you see, we identified 3 major users here. One is the nurse who is going to use the product. One is the doctor who is going to see the data and take action. And one is the administrator for the statistics, dashboard, past data access purpose. So we have these ultimately three interfaces as part of our software. So on the product side, it's a nurse interface who is adding the patient, monitoring the patient and all. On the doctor side, gynecologists have the mobile app who can access the data at any point of time, anywhere. And the dashboard and central monitor, which can be placed on nursing station or at the administration room to actually access the data, past data, it's all. So I'll just quickly skip this. And And these are the offering. So Janitri premium application is the application where it can help you digitalize the whole labor monitoring process and immediate postpartum. Starting from a mother get admitted in the hospital setup after the labor pain till she get discharged. So your whole labor case sheet, which you are writing on your labor case sheet, it's a 15-20 pages labor case sheet. Each and everything we have brought into our premium application, which can digitalize your whole labor process, which includes WHO partograph, pre-delivery checklist, post-delivery checklist. You can calculate all the scores like RUPCHA classification, APGAR scores and all. So ultimately, your whole digital app for your whole labor monitoring experience. Now, what happened eventually in last 3 years? When we have, so ultimately if you see, we have made the sensors small, wireless and Bluetooth based. We have made every product which is an app based. Eventually, the home monitoring market opens for us, which was not there because all the traditional products was too bulky, big, they cannot go home. They even do not transmit the data anywhere. And so eventually for us, because it's a portable small wireless sensor, it's all app based. So now couple of these monitoring like fetal heart rate, NST, non-stress test, all these now can happen at home. In collaboration with the gynecologist and hospital, now we have also started doing that. So ultimately, this product now going home in the last trimester, performing NST test at home. And we are not selling at home. We are just giving that home on a rental model because you don't need the product after delivery. So it goes home based on the doctor recommendation. You can do the test and it comes back. And if you really also want to monitor contraction at home, there is another probe. Now, another thing which is a part of a 1000-day journey is a smart handheld Doppler, which we have launched. Just quickly, you can check the fetal heart rate and within the range of 6,000 rupee. So ultimately, the whole 1000-day journey, you will see in the next 6 months that if you really want to monitor any parameter in this pregnancy, labor and newborn, Janitri will be able to provide you all these parameters with single software for both hospital side and for the home side. A couple of doctor and mother's testimonial where they have used the product, very happy. We are a clinical validation have been publications, all clinically validated product in couple of AIIMS and medical colleges, clinical partners across the country. We have been supported by multiple partners since last 8 years who have supported our journey in terms of funding, investment, procurement, and different government sector have deployed that. Not just in India, even outside. We have been part of Shark Tank India Season 2, where Namita Thapar have become part of our journey and invested in us. So yeah, let's innovate for saving life at birth, and I'm open for any question, and I'm here, we can definitely interact and talk about the product. Thank you.
Thank you for enlightening us about this innovative medical device. And I'm sure that this would definitely help the gynecologists in reducing maternal mortality and maternal complications. Thank you. Now, may I invite the next speaker, Ms. Neha Rastogi. Thank you.
Hi everyone, my name is Neha Rastogi and I am one of the founders of Agatsa. Not visible. Till few years back, this was just a number for us. We all know cardiac diseases are becoming a menace these days, but till 10 years ago, we just knew it, that okay, there is something called cardiac disease until something happened in our own family. My father-in-law, who was 55 years of age, he was a working professional. He just came home and just complained of a tightness in chest. We never thought that a 55 years old seemingly fit person could have anything related to his heart. We got his checkup done. Thankfully, the disease was diagnosed, but the doctor suggested that every time he has any pain or any tightness or any symptom, he has to get his ECG done. So, traditionally, we all know, we have heard this word ECG, and we know that ECG is the first tool and is the gold standard to find anything related to heart. Any disease is detected by the ECG. But nobody ever thought that since 100 years, ECG has been so complicated, not just in the way of how it is taken, like all the leads attached to the body with a monitor, with a huge monitor, and with a paper report in a strip, with a graph, which cannot be read and interpreted by anyone and everyone. Only few doctors could read it. So we know that 12-lead ECG is a gold standard. ECG determines different kinds of problems like heart rate, heart rhythm, variability and everything. But we had a lot of limitations in our ECG machines. Now when we had this problem in our family, and when doctors said that every time you have to do this ECG, my father-in-law used to stay away, and we were working professionals, me and my husband, we both were engineers and, comfortable in our jobs. But we got thinking that, if at any point in time he gets any pain or any symptom in the wee hours or, sitting at his home, who is going to take him to to get his ECG done? And even if he goes, there's a long queue, there's a long process of getting the whole process done. Now we have been, thinking and listening about getting things digitalized, making things portable. We searched and we knew that there were portable ECG devices available, but even those were complicated, they were only smaller, but they were not easier to use. So until the device was this big, we were not satisfied that this was a portable home-based solution, and that is when me and my husband, we left our jobs and we thought that, okay, we will make a solution.
May I request, the sound is too much from the back. I have been requesting with folded hands. It is disturbing the head table badly. Those who are on the exhibition area, please be silent. May I request on the exhibition area, I have been keep on coming to you guys to please be silent.
So to convert anything which was so bulky, which was so complicated, it had to be this big. It had to be without any wires. When I say without any wires, no wires on the body, no wires connected to the mobile or the system, no power, nothing connected to the power, everything digital, everything wireless, everything leadless. This is what we have made, and this device is called Sanket Life. So we had other options available which were like Holter ECG, handheld ECGs, but all of them had their limitations. No device was available until date. No device is available which is a 12-lead handheld pocket ECG which does ECG just by touch. It is only Sanket Life. So obviously when we got working on this, we met a lot of doctors and we got to know about their pain in diagnosing a problem. Now, they told us that most of the deaths happen due to cardiac issues, not because of cardiac issues, but because of the delays that happen due to cardiac issues, because of misdiagnosis or the delay in diagnosis. Now, their pain is that they are too busy, and either the patient with a very small gastric pain is coming to them and taking up their time, with a critical patient somewhere lying and fighting for his life. So definitely this problem had to be solved. Now with this device, this IoT device, anybody can keep it at his home. If it is a gastric problem, the patient can do the ECG himself. He gets to know that, okay, this is nothing related to heart. He sends his, to get the peace of mind, because we only get peace of mind when we listen from our doctors. So to get the peace of mind, he can send the report to his doctor. We have a doctor's app, it's also, and he can get the review within 10 minutes. if there is something critical, the doctor can call himself immediately to the hospital and get his treatment done in time. And even if the patient has undergone any surgery or any, any treatment, the doctor can advise and he can monitor the patient remotely. He doesn't have to call the patient every time to get his ECG done, and the patient is definitely getting convenience because he's having this tool in his pocket all the time, so he doesn't have to go to the diagnostic centers or the hospitals to get the ECG done and then wait for the doctors to read it to just hear that, okay, this is a gastric problem and not the heart problem. So yeah, so these were the opportunities. We were in need of an IoT medical device, which also has AI inbuilt into it, and obviously value-added services like 10 minutes doctor review, which is a lifesaver, because even if if person is having a heart attack, even if he rushes to the hospital, no doctor can see him and diagnose him within 10 minutes. So this is this is how Sanket Life 2.0 is innovated. It is a touch-based ECG, pocket size, cost-effective. Like this is another factor which adds to the value of Sanket Life 2.0, that it is the most affordable ECG device, and that's how everybody can carry it and everybody can keep it at home, like a thermometer, digital shareable reports, real-time info, and cardiologist review. So how Sanket Life 2.0 helps? Quick ECG at home, quick ECG at OPD and clinics also, because when we met doctors, we came to know that not all the doctors have ECG apparatus in their clinics, and especially who are not specialists, who are not cardiologists. So this device is helping them diagnose the patients, even the walk-in patients in their clinics at the right time, patient management, and definitely remote consultations. Then when we got more into the system, we came to know that, doctors, and another pain point that, this device, a healthy patient can still use. But if a person is already unconscious, or if he's too old to hold it stably, the leads had to attach. So we innovated another version of Sanket Life, which was Sanket Life Pro Plus, which was mostly directed for hospitals and doctors, and the same device can be converted into a lead-based system for the continuous monitoring or the simultaneous monitoring for unconscious patients, or the patients who are too old to hold the device and take the ECG. So in the last session, IOMT session, I was hearing that, tagging the medical devices so that the nurse can actually find where the ECG machine is kept in the hospital. Why not each nurse having an ECG device in her pocket, and she can quickly go and get the ECG done. So yeah, that's what Sanket Life offers. So in COVID times, we had another product which was an amalgamation of ECG and other parameters, because SpO2 and temperature were other parameters which had to be monitored during COVID times. So Multivital was a device which is again a pocket device with the screen onto it, which could take 12-lead ECG and also SpO2 and temperature just by touching. So these are the other products that Agatsa offers. Then NCheck was a experiment. We had researched a lot, and we had made device which could take blood sugar just by touch. So no pricking, no blood is required. You just touch the sensors and the blood sugar is monitored. This device is still not commercialized because we are still making it more accurate so that it can be used in medical purposes, clinical purposes. Then H360 is another product which is soon to be launched. It has a very beautiful feature, which is touch-based blood pressure. So till now, even blood pressure, nobody has thought that we can go away with those cuffs and we can just monitor the blood pressure by putting our finger into a probe or a hole. So this is a device which can take ECG, of course, but touch-based blood pressure, then SpO2, and then, of course, other features and other services are already there. Then this is a standalone blood pressure cuff, which is again, people who are not able to monitor their blood pressure through touch, they can wear the cuff, the standalone cuff, and continuous monitoring can happen. Then this is a wearable ECG patch for continuous monitoring of ECG for people who are going to gyms and people who are having arrhythmias, because for arrhythmias, continuous monitoring is required. So yeah, this ECG patch can be worn at all time, and the report can be shown to the doctor. Digitally again it can be sent, and the diagnosis can be made. So Agatsa, in last 10 years, we have not just made the devices. There's a lot of chatter about AI, but to reach to a point where the device or the machine can interpret or diagnose a disease, we need to have devices which can collect data. So these devices are towards an effort towards that. And of course, once the data is collected, now we are building the algorithms over it so that the device itself can diagnose and interpret a disease before a doctor, and also it can detect a disease earlier. So, prevention of disease can happen, and not just the diagnosis and treatment. So we have devices, we have our mobile app, and then all the data is stored on the cloud, so the reports can be fetched back, and past reports can be referenced. So how Agatsa Health Platform helps? Quick and accurate detection, in your pocket all the time, remote review of ECG report by cardiologist, disease management by remote monitoring, and patient engagement, because doctors and patients can work collaboratively towards managing the disease, so patient engagement also happens. Future possibilities with Agatsa's platforms, we have not explored these, but yes, constant cardiac monitoring for gym goers or athletes, artificial intelligence prediction of disease, like I said just now, effortless heart management, quick triage system for medical systems, like there can be a common system in the hospital monitoring all the devices all the time, and as soon as a SOS button is pressed, the hospital can send the ambulance to the patient's home and can pick the patient on time. So these are the future possibilities and future projects that Agatsa is hoping to go for. So this is the impact by Agatsa so far. We have sold about 25,000 devices, and the devices are sold to both the individuals to use at their homes and also to the doctors, and now we are integrating with the hospitals also, so that hospitals can use these devices in their premises or outside their premises for the patients who have just got operated and any high risk patients. We have saved a number of lives, and of course the number of diseases captured are there. Like our devices are medically validated, so any disease which is captured on a traditional ECG device, our device is also capturing that disease. So this is a roadmap of, we are present all over India right now. These are some of the prestigious awards that we have won over the years, and mostly all the awards for innovation and invention. These are some of the memorable moments that we had in the past. We had a privilege to showcase our device to Honorable Prime Minister, and have won a lot of awards in the past. So yeah, so this is about Agatsa. Thank you so much.
Thank you, ma'am. Again, a very useful device, and I've been lucky. I have had the opportunity to use this device for my family, and I must congratulate you, ma'am. It's a very nice device, and I'm glad that you continue to innovate. It is a very small device, around 2.5 inches long, can be kept in the pocket. It easily connects with your smartphone. And taking ECG is not that simple. There are various leads which have to be connected at various positions. If the position is not right, the ECG won't be right. So the smartphone, the app of Agatsa app would guide you where to keep, where to place the device. And it's not a big hassle. The ECG is taken very easily. And it's generated in PDF format, which can be sent to the doctor immediately for consultation. And I am pretty sure that it must be saving a lot of lives, because it makes life easier for the doctor, and it makes a very safe thing for the patient also. Thank you. May I invite the next speaker, Mr. Ashwin Amrapur, please.
Hi, good afternoon. I'm Ashwin, and I'm co-founder and CEO of Aikenist. So how many of you must have actually really faced like difficulties in going through MR or CT scans? Can you raise your hands? I'm pretty sure, I mean, everybody would have felt a lot of claustrophobic going through the all these scans, but it's quite inevitable when you're facing very difficulties in many critical illness or important issues. So what we at Aikenist we are making is medical imaging very affordable, convenient and like faster. So with our software, we are completely, the name says it, it's a AI based knowledge specialist. So we built all the AI technologies to make things simple and easier. A little bit about ourselves. We started in 2019, end of 2019, started by serial entrepreneurs. We, after years of research, we built the first technology based on generative AI in 2022. So we built the generative AI technology much before, today it became a very fashionable word. So in 2023, we got ISO 13485 medical device certification. We started last year with about 100 installations. Today, we are happy to say there are about 300 installations. A lot, it's only a software, so we sell it as a pay-per-use subscription-based pricing, and our customers predominantly are radiology centers, med device companies, pharma companies, all across India, but also more than 6-7 countries we are already there. The team is an experienced team in the deep tech business itself. We have built the business. We have built technologies of very reputed technologies which we have sold, not just in India, but more than 30 plus countries. We have doctors who are experts in this domain. We have business leaders who have built business in this space as part of the team. So it's the very experienced team which has come together to build the technology, what is revolutionizing the medical imaging today. So setting the context, you must have seen any radiology process is not a easy process for you, right? So it's a very, especially for patients, they feel claustrophobic going inside the MR machines, right? And they really worry about the exposure to radiation when it comes to the CT, right? And also they have to wait for longer times. And sometimes if it is a public-private partnership, as we see names I was just talking to a doctor, what's your waiting time? They said 2 years, right? I know in the paper it has come 1 year. I was not surprised that it's even more worse. So that's the kind of access to important medical technology which is there today in India, right? So, and also for the radiology centers or the diagnostic centers, they want to make better utilization of the machines because these machines are not cheap. Each machine costs you about $1 million to $2 million, and they really want to actually use maximally whatever they have invested in, right? So this is also once you actually have the scanning done, but again there is the access to radiologists, that itself is a major problem, right? So there are not enough radiologists. We have about in 1 in 10,000, one radiologist is for the 10,000 of people. That's very low number in India, right? So that's a kind of the skewing that's there. So considering all this thing where we see that it takes days to get an appointment, to get a scanning done, everything, right? So it's really important problem to solve. And it's not just India problem. And if you're thinking that it's a India problem, it's a very global problem. And you'll be pleasantly surprised that countries like Canada or UK, there is like 6 months waiting period. Okay, and that is if you are not like very emergency, right? It's easily about 6 months. So that's the problem that we are going to solve with the technology. So what we built is a suite, which we call it as a quick suite, which is a end-to-end software stack built on AI platform completely, and making the thing simpler. So we cut down the time by 70% at every step. So we looked at it. So how do we make this very easy? So today when you actually go and do a security check, how much time it's going to take? It's going to take you maximum about 3 to 5 minutes, right? So why is your scanning inside the body is taking so much of time, right? So that's what we are trying to change with our technology. The first is that you want to get an appointment time based on the emergency. We have a solution called Quick Flow. So we look at the prescription, and based on that, we devise the solution to find out what will be the optimal slot that we can give it for the scanning. Next is a quick scan. This is a patented technology. Patent has been awarded to us. With this technology, what you can do is that, let's say you take about 30 minutes with the scanning with the existing machines. It can take about 15 minutes with the same software, right? So that's the cut down of 50% of the time with the existing machines. And today, if you have machines which is about 1.5 Tesla, which is 5 years old, it can easily extend the life of the machine by another 10 years. So it's the same hardware, it's the same coil, but we extend the software using software. So that's a completely a software-defined MR. So same thing with about the CT. CT is more about the problem of radiation exposure. See, we cut down the radiation exposure by more than 70%, right? So that means that you are much more safer inside the CT. And then we want to automate the reports because there are not enough radiologists. Suppose you have a stroke and somebody suffers a stroke, then you want to detect immediately, and the care has to be delivered within few hours, right? So that is what we do that. We detect stroke, we detect what is the extent of damaged tissues, and with that we recover those tissues using mechanical thrombectomy by doctors. Finally, the entire put it in a platform which is a radiological, so it is cut across like CT, MR, X-ray, nuclear medicine, everything together, all built on AI, and it can easily help for the radiologist to prepare reports much faster, share the reports with the patients much faster. So we come across all the things that as part of the workflow for the patients. In terms of, I talked about how we can get a better appointment time, and in terms of quick scan, I just want to give you a little bit, spend more time on this because it's a very, very key solution that we have done after years of research, and we are the only person in the world, like one company, or there's one other company in the US, the only 2 companies which have come up with this kind of technology in the world. So that's like something very unique that we have done, where we actually take with a faster protocol, you take it GE, Siemens, or Philips machines, you use a fast protocol that we prescribe, get the scans faster, and we do the processing outside the MR machine. What used to happen inside the MR machine now happens outside the machine, so the patients can actually come out and walk out very easily. And this is what just one sequence where on the left you say it takes about 1.1 minute. The same sequence, we do it about 30 seconds. And there are about 10 to 15 sequence like that for each scans. And this is again, it's a real hard validation because one of the few companies which have done in the world. We have done several validations, and we cut down the time in some cases in more than 70% of the time what is today. It also helps to save power because we can do less number of hours for the operation. We have done about 500 patient study where radiologists agreed that the images were sharper, lower noise, and there is a good delineation of pathology and anatomy with a user-friendly viewer what we provide. And then we actually, today we have talked to a lot of physicians, doctors, and they say we can't really find out how consistently we can make out what radiologists are reporting enough, right? So first of all, they can't read the scans by themselves. Second, they cannot easily understand the reports by themselves. So we automate the report generation also. So what today radiologists can do is that what they are seeing, they just need to tell, I've seen a stroke at certain position of certain size. Then we immediately generate a report which is very parameterized, which can be actually read by any physician. So you go to the cardiologist, orthosurgeon, or the neurosurgeon, so they can easily read the report what we provide. So again, it cuts down the time by more than 70%. So the entire thing we put it, and just I want to show some of these things what we do with our solution. Very fast reporting, 3D cross section that we do. We do 3D volume rendering. We do pathology. So there are multiple types of pathology and radiology and other things actually comes together to provide a very effective report. We detect using AI and auto-generate the reports using AI. We use nuclear medicine, so a lot of quantification people do where the cancer things are always the progress. So we do that with our solution. So the entire thing actually we put it in a single platform as we see. And a little bit more on kind of things that we detect is for using CT-MR is the stroke. So as I talked about, stroke is most important. You do MR based stroke detection or the CT based stroke detection, and we provide a comprehensive study. Again, this is one of the very few companies, very advanced technology, one of the very few companies in the world we are providing this kind of technology. And this kind of technology where we can detect stroke very accurately with a pinpointed location, and how much to recover the cost is another thing which is very unique for the doctors. Same thing with the CT stroke AI and mammogram breast cancer detection, again, very accurate breast cancer detection. For X-ray AI, again, based on the nodules, what you have inside, suppose, you can detect with using X-ray. And then they do something study about the perfusion, how much, where is the blood flow happening in the stroke, and then how to do. So it's that kind of technology that we have developed. This is another important technology. So your body health depends on how much is your visceral fat is. So we do a lot of abdomen fat quantification using technology. And then the same thing with the thigh fat quantification. Other is about your spinal compressions, fractures, and those kinds of things. All the measurements we extract using AI. So what you see is a glimpse of what is going to come in days, because a lot of things, the AI, what is not possible today is going to make it very easily possible. So fast forward 5 years, everybody, just like how you do your airport screening, you'll just do screening of your body and potentially can detect if there is any ailments inside much ahead of the time that you're going to suffer. Thank you.
Thank you. Again, a very nice example of artificial intelligence making the entire process faster, easier, simpler. Thank you. Now, may I invite the next speaker, Ms. Nayamat Bindra, please.
Hello. Yeah, I wanted to just ask everybody, how many of you have actually checked your lung health at home? So Swaasa does exactly that, and I'll take you on the Swaasa journey. Volume.
ML models to detect respiratory ailments like tuberculosis, COVID, COPD, pneumonia, etc. Typically, when a patient consults a doctor with respiratory ailments or symptoms, the doctor can advise Swaasa test and other possible diagnoses. A small and quick enrollment can share the web link with the patient on their phone. The patient can start recording cough sounds in their Swaasa application. The results are instantaneous. On one side, the patient can see the preliminary assessment of their lung health and associated risk. Simultaneously, the doctors can access a detailed report of the cough sounds on their web dashboard or mobile device. The report provides general lung health read comprising of spirometry results followed by identification of various respiratory diseases. In cases where the symptoms indicate a high risk, the doctor can choose to refer the patient for additional tests for further treatment. Swaasa is developed and maintained by Salsit Technologies, and we are committed to making respiratory healthcare accessible and affordable to everyone.
So as you just saw, Swaasa, which means swas or SARS, it's from the Sanskrit word. We work in respiratory health and we're unbound. Unbound means we're not restricted to a certain geography. We are sorry. Yeah. So what do we are Swaasa, we use audiometric analysis of cough sounds to assess the risk level and identify the respiratory disease or ailment. So we work in the space of respiratory health. If you see something like this, you also must have seen this in your car, but this is like our lung health index, which is basically that tells you what is the lung health of the person. So green zone, orange zone and a red zone. What is our solution? Our solution is accurately vetted. It's a cloud-based analysis based on a 10-second cough sound via a smartphone. We are real-time, so it's in a few seconds. We're inexpensive. We are scalable. We are unbound. We are accessible anywhere. And most of all, anybody can use it. Any trained person who has basic knowledge of a smartphone can use Swaasa. So what is the magic? What do we do? So we take the cough sounds and a respiratory questionnaire and put it through our algorithm, and then we come out with these outputs for you, whether the person has a respiratory disease or not. So that's the first thing we can tell you. What is the pattern of the person? Is it obstructive, restrictive, mixed or normal, the lung pattern? The severity. And we also give you spirometry values. We can also tell you the lung, the rich data, which is the lung, I would say characteristic, whether it's a wet cough, a dry cough, and the LHI. We're able to detect the likelihood of COPD, the previous strain, asthma, TB, and COVID. What are use cases and offerings? We work in screenings in community health and population health through screening camps and checkups, OPD or CHCs and PHCs. We aid in diagnosis, in triaging, and aid in treatment, diagnosis, and monitoring with remote patient monitoring and in occupational health. This is a little image of how we do the lung health screening. These are some of our patents and publications. So we have CDCO and we are applying for FDA and CE. We are aligned with this. We are aligned with the Sustainable Development Goals, goal number 3 and goal number 10. These are our data security and quality standards. Our trusted global organizations. So the spirometry, as you know, requires significant capex. So lab setup, equipment cost, OPEX of lab technician, power, consumables. Whereas Swaasa is just a mobile phone. You just need a mobile phone for to assess the lung health through Swaasa. This is just some analysis. The basic costing of how much it would be. Our results, so not everybody can do a spirometry test. So severe COPD patients find that difficult, whereas in Swaasa it's a little much easier. We are also we've joined hands with our Honorable Prime Minister in the call of TB eradication and pulmonary TB, so for TB Mukt Bharat. So of course we are also wanting, and our mission is that no respiratory illness death that could have been prevented should happen. These are some images. We have over 12 clinical trials, over 8 patents, 9 research publications, and over 18 recognitions. Our emphasis is on scientific rigor, scalability, and medical AI capabilities. Thank you.
Thank you, ma'am. I'm really surprised with the innovations that are taking place. It's wonderful to know that this app is giving so much of information which would help and aid the clinician in reaching a diagnosis very fast. Thank you. May I invite the next speaker, Dr. Seema Singh, please.
A very good evening, everyone. In this panel of Illuminous tech founders, I feel like the only odd one out because I'm not a tech founder. I am a domain expert and a business person. I'm the founder of Unconsult. Unconsult is a business consulting service with a difference. We are not traditional consultants who come from consulting backgrounds. We are a group of people who have worked in businesses in trenches. We have worked as domain experts. We have worked in early stage companies, in late stage companies, and we have scaled up businesses. And we work very closely with early and mid stage companies to help them go to the market and to help them scale. Because at the end of the day, whatever gets built by these innovators has to be taken to the market, has to be scaled up, and has to be sold. So that's what Unconsult is all about. A bit more about myself. Well, I am a medical doctor, a general surgeon by training, practiced surgery for 15 years. After 15 years, I hit a midlife crisis, did an MBA, and have been working in the digital health space since then. So these are not just logos. These are some of the early stage digital health startups that I have worked with over the past 7 years. And you can see a lot of names here. The domains would range from chronic disease management to infection management, to post-discharge care management. You can also see some accelerators here because I also work as a mentor with early stage startups. And the latest stint is I work with the Technology Innovation Hub of IIT Delhi, helping, I would say, indigenize the medical technologies. So this is a bit about me. This is the kind of work that I've been doing for the past 7 years in my second innings of my career. You have been hearing about all the technologies, all very specific innovations in healthcare, in digital health throughout the day. What I'm going to talk about is more of a 30,000 feet view of this space. What is happening in the digital health space? What is the kind of money that is flowing in? What is the kind of value that is getting created? What are the kind of problems that are getting solved? And what's in future for this space? So it's more of going to be more of a 30,000 feet view. We have all been talking about this since morning, that health tech startups, they are the new stars of the Indian healthcare ecosystem. And having listened to my fellow panelists, I'm sure we all agree that these are the people who are leading the innovation in healthcare from the front. Just to look at the numbers, these data have been collated from the Startup India's website. In the healthcare and life sciences domain, in the time period 2016 to 2023, since the Startup India mission has been in existence, 11,000 plus startups have been recognized by Startup India only in the healthcare and life sciences domain. So you can imagine the kind of scale at which we are making progress in the healthcare domain. 1.11 lakh plus employment generated and 127% growth. So this is the kind of development, the kind of pace at which this industry is moving. And when you look at region-wise analysis, among all the startups across domains, health tech startups, healthcare life sciences startups have been some of the top performers. This is one region. Startup India report has data from all the other regions, and in all the regions, healthcare life sciences seems to be the star. So a lot of startups are getting created, and we all know, the ratio of success of startups is 1:1,000 maybe, or maybe even less. So is it just that these startups are getting created? Are they really, delivering any value? Are they really making money? So this is a report which was published by Invest India, which talks about the Indian unicorn landscape. And here they talk that healthcare is one of the star performers. Some of the health tech startups which have originated out of India have gone international, made their mark in the US market. We all would have heard about companies like Innovacor, Indigenes. These are some of the star unicorns of this industry, which were born in India, and they have made their mark across the world. This is a BCG report which projects the growth over the next few years. And it says that by 2030, the size of this market is poised to grow by 10x. So total digital health market, including the various domains, e-pharmacy, e-diagnosis, teleconsultation, everything is poised for growth. And wherever a sector is growing, one of the proxy indicators is the kind of funding that is flowing in. So this is a year-on-year funding which has flown into the health tech sector. And you can see that during COVID, this suddenly peaked. 2020, 2021 saw a humongous amount of funding flowing into this sector. We'll talk about the factors which have influenced this market, but for now, just look at this graph. Look at the way it climbed. It has declined over the past few years due to various reasons. There is a funding winter across, and obviously the domain is not untouched by that. But just look at the numbers here and look at the kind of funding that is flowing into this space. And the more the funding, the more the risk that a founder can take, the better the kind of innovations that they can do. And it's not just funding. Look at the number of patents that are getting generated. We talk about innovation. So healthcare in India till now has been traditionally a hospital-led business. We have had large businesses which have gone public, large hospitals which have gone public, which have generated money. But what about innovation? What about new technologies? So we as a lot of startup founders are here. We are not lagging behind in any way in new innovation. Just look at the number of patents that are getting generated in this space. So it's not just that we are making money, we are innovating, we are generating new technologies. We are at the cusp of a flexion point wherein a lot of new medical technologies are going to come from India, rather than India being the usual importer of medical technologies. So what I spoke about till now is something you are all aware. That is the reason why we are here today talking about digital health. But just a sneak peek behind the scenes. Why is there a sudden jump in the number of healthcare founders, technologies, money, funding? What's going on behind the scenes? And I love to talk about this thing that I call as enablers of the ecosystem. First and foremost, we had a gentleman from ABDM talk about it. First and foremost is the push of the current government on these digital technologies. I have listed some of the logos here. Startup India, we all know about how they are supporting and funding startups. Make in India is giving a lot of push on indigenization of medical devices and technology. The aim is that India should no longer be a net importer, we should be a net exporter of healthcare devices. National Health Authority, Ayushman Bharat Digital Mission, we all heard in the previous session how they are creating a baseline layer on which newer applications can come and they can revolutionize the space. One very specific mission that I want to talk about, and something which I am very closely associated with, is a national mission on interdisciplinary cyber-physical systems. This is a mission under which Government of India, Department of Science and Technology, has established technology innovation hubs across all the major medical and technical institutes in the country. So we have what we call as TIHs. We have 25 plus TIHs today across the country. These are housed out of premium institutes like the IIT Delhi, IIT Mumbai, IIT Mandi, and some of the tier 2 institutes as well. What these innovation hubs are doing, they are supporting researchers as well as startups. So any research which is slightly technology ready, any startup which is new into market, working in health tech space, is being supported by these TIHs in terms of providing funding, mentoring, guidance, technology transfer, connects with industry and all. So I work as an advisor with iHub Foundation for Cobotics, which is the technology innovation hub of IIT Delhi. And we have recently set up a very dedicated medical center, what we call as a medical cobotics center. And this center is focused entirely on supporting products based on AI and robotics in health tech domain. So this is the kind of enablement that is happening for this industry, this domain currently. Technology as an enabler, in the last session we spoke a lot about IoT, AI, ML and all. So these new technologies, some of the technologies which I, over the last 7 years, have seen grow exponentially and which I feel today are the major game changers. I have just listed down those here. First and foremost is cloud computing, the kind of cloud computing power we have today. Without this, any AI ML algorithm, any large language model would not have been possible. So cloud computing was the first thing that changed the whole space. AI ML, we worked in an AI ML startup 3 years back, and we were struggling with digitizing the doctor's handwritten notes. We tried natural language processing, we were not successful. Come 3 years later, today large language models are able to even listen to the conversations, read handwritten notes, and convert them into digitized data, and also able to extract information out of it. You all would have used ChatGPT. So ChatGPT kind of applications in healthcare are changing the whole scenario. Robotics is a domain which is close to my heart since I work very closely with it. A few other things, and I would like to talk about sensor technologies because most of our startups sitting here on the dais are working in that technology. So a lot of new sensors being developed, although a lot of components we are still importing because it's still not being made in India, but we are definitely making progress in that direction. A lot of sensors enabling home monitoring, enabling point of care devices, enabling a much closer monitoring of the patient in conjunction with Internet of Things. So these are some of the technologies which are currently driving the innovation in this space. We have heard about these technologies from the founders themselves. Now coming to the biggest enabler, the biggest push for the digital health market in the country. While COVID was not a good news for most of the industries, somehow for digital health, COVID acted as a boom. So when I started working in the digital health space way back in 2015, when we used to go to the doctors and we had a solution for management of diabetes, we used to take it to the doctors and the question was, what's in it for me? Why should I even try a digital technology? And suddenly after COVID, it's the other way around. The doctors would come to us and ask, do you have any solution that can make our lives better? So that's the kind of sea change that COVID has brought in. The user acceptance has certainly skyrocketed. You can see it from all these apps, the number of downloads that have happened in the past. So these are some of the things, the changes that were majorly pushed by COVID. Today the user is, especially the doctors, they are far more open to adopting technology solutions than they were prior to COVID, majorly because during COVID times we have all seen the kind of potential that's there in this space. So just a brief overview of what kind of companies are coming up. You all know that, I don't need to talk much about it. And I have an eye on the clock also. So these are some of the sectors in which companies are working: health and wellness, healthcare services, pharmaceuticals. According to a NASSCOM report, these are the common problems that are getting solved. A lot of these companies are working on accessibility and affordability of healthcare. You would have gathered from the kind of presentations that happened here. A lot of these companies are working on improving the accessibility and affordability. These are some of the kind of businesses, integrated healthcare providers. We all know these are the IHPs are the stars of the ecosystem today. We all know PharmEasy, Precto, Tata 1mg. Then there are healthcare SaaS companies. As I mentioned earlier, a lot of these SaaS companies, although they are born in India, but they have a US-focused business for various reasons. Innovation and Indigene being the Indian unicorns. Then we also have some other healthcare SaaS companies. E-commerce and personalized healthcare solutions. We heard about Swaasa, we heard about Sanket. All these are personalized healthcare solutions which can connect the patient to the doctor. So this was all of what I wanted to talk more as a general overview of the industry, what's driving it. We can go on talking about the other side, that is the challenges which all of us who are working in the industry face, but maybe that's a story for another day. Just to conclude, I would like to highlight a few points which were highlighted in a recent report published in the ET Health. Going forward, the funding is going down. A lot of consolidation will happen in the industry. For companies to succeed, they will somewhere have to look at a phygital model wherein they will have to integrate some physical devices or services with the digital models. Digital-only models are more difficult to survive. Vertically integrated care will be more successful, and patient experience remains the bottom line. Healthcare being a space where patient experience matters a lot, we really cannot get away from a good patient experience, whether we are a digital, phygital, or a brick and mortar setup, patient experience remains the same. And we are hoping for tech being built in India for the world. Thank you.
Thank you, ma'am, for a very informative talk. Now the session is open for questions. Any questions, please? No questions, so we end the session here. Thank you.
Thank you very much, ladies and gentlemen. We keep on listening. Data, 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 one side. Digital, digital, digital. You know. So what I feel is, after listening to everybody, we can give all the credit to the government and everybody. But all these devices really got a push after the COVID. I think half of the room, those who are sitting here will agree, because the real push came after the COVID, you know, because only the COVID patient used to come to the hospital. The other people, whether it is cardiology problem, gynae problem, all used to scare to come to the hospital. That's how all these entrepreneurs have come up, and now the funding has started. So congrats to all of you, the entrepreneurs in the digital health. Some entrepreneurs should come up with this room also soon to join you to take this digital health to the next. So I request Dr. P.N. Singh to present the mementos to the distinguished speakers. First to Mr. Arun Agrawal, founder Janitri. I really found this Janitri things very good for all the hospitals, like Swaasa and other things. This is also very good, these things. Neha Rastogi. You know, what a coincidence that Dr. P.N. Singh is already using the device, and here is the founder. Ashwin. Namath Bindra. And Dr. Seema Singh. We also heard how Dr. Seema has changed from the medical to the digital and the business lady. Dr. Saab, I will present a memento to you. So we'll have a quick 15 minutes tea break. Please join us back, the last session, then we'll get into the cocktails and dinner. So, so just 15 minutes quick break.